molecules that are too large are moved out of the cells through vesicles. So, midwifery, you have question number 4 and question number 18. You pick one. 17 rather. Question number 4 and question number 17.
Question number 4.
Question number 4. Contrast between thrombus and embolus. Or differentiate between thrombus and embolus. Okay, bonus to the public health department. Contrast between thrombus and embolus.
Madam, please. Embolus is the stasis of air inside the blood vessels, and thrombus is stasis of clotting of blood inside the blood vessels.
Can you go back it again, please?
Embolus is when air particles or air is being stuck inside of vessels, and then the thrombus is when blood clots inside the vessels.
Okay, correct for halves. Because when you look at thrombus, in thrombus you are looking at a blood clot in the blood vessel, but in embolus, blood vessel carries it away. So the thrombus part is correct, but the embolus is still struggling. So correct for half. Please clap for them. Okay. So we have a public health department. You have question number 17. The last question for the round of human anatomy and physiology. Please listen carefully. It's divided in two ways. One type of cell division is called meiosis, which is part of that. The other is mitosis, which is necessary for what? I'll go over it again. A cell can divide in two ways. One type of cell division is the meiosis, which is part of what or dash, and the other is mitosis, which is necessary for dash.
Madam, please, with the mitosis, there is division of cell into two daughter cells. And then with meiosis, division of cell into 4 daughter cells.
Now the question is, meiosis is part of what, while mitosis is necessary for what?
Cell division for meiosis. Or gametocyte.
And what?
A somatic cell.
Answer correct for 2 marks. Meiosis is necessary for gametogenesis, while meiosis is part of gametogenesis, while mitosis is necessary for cell growth. So we get half mark for them. Okay, that is it for anatomy and physiology. That is the end of the round for anatomy. Please, let's give a round of applause to them. Now we are going to go over to obstetric.
Hello, try to.
Wait for the results of the first round, or the anatomy.
Hello? Hello? Hello, try 2. Hello, try 2.
All right, at the end of the first round, we have nursing having a score of 16. 16. Hello. Okay. So but you can keep the mic.
Okay, now let's go to obstetric questions.
Should we start from the next one or we should start from the problem? Okay, I should do one, two, three. I should start from next year, I should start from problem. Because we started from general medicine. Let's start from problem.
Okay, we are going to start from the public health department. From question 1 to 15. Now I'm going to be question 1 to that's how we are going to go. Now, public health department question 1. During the follicular phase of menstrual cycle, the secretion of estrogen is controlled by dash and dash, which are released from dash gland. I go over it again. During the follicular phase of menstrual cycle, the secretion of estrogen is controlled by dash and dash, which are released from dash gland.
So, in the follicular stage, the anterior pituitary gland is anterior pituitary gland produces secretes the follicle stimulating hormone and then the luteinizing hormone.
Correct for 3 marks. Midwifery. During the secretory phase of menstrual cycle, the ruptured follicles becomes dash. During the secretory phase of the menstrual cycle, the ruptured follicles becomes dash.
It becomes the corpus luteum.
Correct for 3 marks. Now, general nursing. As the Gravian follicle matures, a massive amount of estrogen is released by the follicle, which causes a luteinizing hormone surge. Approximately, what cycle day does the LH surge occur? I repeat the question over again. As the Gravian follicle matures, a massive amount of estrogen is released by the follicle, which causes a luteinizing hormone surge. Approximately what cycle day does the luteinizing hormone surge occur?
The 14.
The what?
The 14.
Wrong.
The 7.
Wrong. Okay, bonus goes to the public health. As the Gravian follicle matures, a massive amount of estrogen is released by the follicle, which causes a luteinizing hormone surge. Approximately what cycle day does the luteinizing hormone surge occur? 34 days. Okay, midwifery. As the Gravian follicle matures, a massive amount of estrogen is released by the follicle, which causes a luteinizing hormone surge. Approximately what cycle day does the luteinizing hormone surge occur? Okay, there is an increased surge of luteinizing hormone at day 11 to day 13. You see, at that point, we normally have an increased amount of luteinizing hormone that prepares the body for ovulation. Okay. We go back to public health, right? What cycle day does the luteal phase occur? What cycle day does the luteal phase occur? What? 14. So what? 28. Correct for 2 marks. It's the 15 to 28. Okay, midwifery. Question number 5. The mother has delivered the placenta. You know that the shiny surface was delivered first. What delivery mechanism is this known as, and what surface of the placenta is presented? The mother delivered the placenta. You note that the shiny surface was delivered first. What delivery mechanism is this known as, and what surface of the placenta is presented?
The surface of the placenta presented in the fetal package. The delivery method is the spontaneous vaginal delivery.
Correct for 2 marks. Now is the Scott's mechanism, and the placenta surface presented is the fetal surface. Okay, general nursing. During the 3rd stage of labor, you note a gush of blood and that the uterus changes shape from an oval shape to globular shape. This indicates, during the 3rd stage of labor, you note a gush of blood and that the uterus changes shape from an oval shape to globular shape. This indicates
it means that I the question again.
during the 3rd stage of labor, you note a gush of blood and that the uterus changes shape from an oval shape to globular shape. This indicates
You try me.
Okay, the bonus goes to public health. During the 3rd stage of labor, you note a gush of blood and that the uterus changes shape from an oval shape to globular shape. This indicates
Expulsion of product of conception.
Okay, to the midwifery. During the 3rd stage of labor, you note a gush of blood and that the uterus changes shape from an oval shape to globular shape. This indicates what?
Indicate the contraction of the uterus.
Wrong. It indicates postpartum hemorrhage and the separation of the placenta. That's what it indicates. Okay, now next question goes to midwifery. The last question was for general nursing, right? It was for them. Okay. Next question goes to public health, sorry. Your laboring patient has transitioned to stage 2 of labor. What changes in the perineum indicates that labor is imminent? Your laboring patient has transitioned to stage 2 of labor. What changes in the perineum indicate that labor is imminent?
Swelling, reddened perineum, swelling, bulging perineum.
Correct for 2 marks. Bulging perineum and rectum with an increased blood flow. So correct for 2 marks. Please, let's clap for them. Okay, midwifery. When implantation succeeds and the blastocyst adheres to the endometrium, the dash secretes HCG, a hormone that directs dash to survive. When implantation succeeds and the blastocyst adheres to the endometrium, the dash secretes HCG, a hormone that directs dash to survive.
The trophoblast cells, specifically syncytial trophoblast cell, secretes human chorionic gonadotropin hormone
that directs dash to survive.
That keeps the endometrium taken for the pregnancy to be viable.
Correct for 2 marks. It directs the corpus luteum to survive. Okay, general nursing. Maternal and fetal blood does not commingle because maternal and fetal blood does not commingle because
Because of the placenta.
what happens in the placenta? Wrong. Bonus to the public health department. Maternal and fetal does not commingle because
the placenta is a source of nutrition, circulation of blood, and all other needs of the fetus to itself through the placenta. But the mother's own also is within herself, but the baby derives that through the mother.
wrong. Midwifery, maternal and fetal blood does not commingle
because of the umbilical cord.
wrong. Because blood cells cannot cross the placenta. It will cause a reaction. The mother's antigen will fight against the child. So blood cells cannot move across the placenta. That's the correct answer. Okay, public health, question number 10. During the second week of gestation, the trophoblast and embryoblast divide into increasingly specialized cell types. The trophoblast divides into dash and dash cell types, while the embryoblast divides into dash and dash. During the second week of gestation, the trophoblast and embryoblast divide into increasingly specialized cell types. The trophoblast cells divide into dash and dash cell types, while the embryoblast divides into dash and dash. Please, audience, please, total silence, please.
Madam, the inner cell mass, wrong. The morula wrong.
The gestation is still within the pregnancy stage, right? No.
The bonus to the midwifery. During the second week of gestation, the trophoblasts and embryoblasts divide into increasingly specialized cell types. The trophoblast cell divides into dash and dash cell types, while the embryoblast divides into dash and dash.
The trophoblast divides into cytotrophoblast and syncytotrophoblast. And the embryoblast divides into epiblast and hypoblast.
Okay, midwifery, your question. When the midwife clamps the cord, the circulation through the umbilical vein ceases and the cord collapses. The abdominal portion later becomes fibrous to form a ligament known as dash.
Ligamentum teres.
Correct. General nursing. After the birth of the baby, heart circulation changes due to closure of the shunting structures in the baby's circulatory system. What is the reason for the closure of these shunting structures? I'll go right again. After the birth of the baby, heart circulation changes due to closure of the shunting structures in the baby's circulatory system. What is the reason for the closure of these shunting structures?
Okay, madam, the shunting structures, the shunting structures will close because the lungs is matured. So the pressure that is built out at the left. There is a pressure that is built up at the left atrium.
Okay. Is wrong. Public Health Department. After the birth of the baby, heart circulation changes due to the closure of the shunting structures in the baby's circulatory system. What is the reason for the closure of this shunting structure?
To prevent the backflow of blood.
Wrong. Midwifery.
Madam, after the delivery of the baby, the shunts are of no use again, so they...
Okay. Now the correct answer is that the pressure in the right side of the heart will reduce and the resistance that is in the lungs will also decrease. So when the resistance in the lungs decreases, pressure in the right side of the heart also drops. You see that the shunts start closing. Okay. Well, the question was for who? So we are going to public health. Which are non-pharmacological forms of pain relief during labor? Which are non-pharmacological forms of pain relief during labor?
Madam, non-pharmacological pain relief during labor are strategies or measures being
Name the forms. What are the forms?
Massaging, talking to the client so that psychologically she should be relieved of her pain, and also motivating.
Okay, correct for 2 marks. We have skin stimulation, that is massaging. We have diversion and distraction. You can be talking to the person. Then we also have some breathing techniques. So for 2 marks, correct. Let's clap for them, please. Clap for them. It was your question, right? So midwifery, your question. Mr. and Mrs. Latte arrive at the clinic for their first prenatal visit. Mr. Latte tells you that the women in their family usually have girl babies first and wonders why some women have only girls. Your correct response will be
the sex of a baby is determined by the man. The man has X and Y chromosome, and the lady has XS. So if the man deposits Y chromosome, it will be a male. If he deposits X, it will be a female. So it is dependent on the male.
correct. The last question for nursing. After birth, where do you assess fundal height? After birth, where do you assess fundal height?
Madam, please, the abdomen.
Abdomen, where?
The upper parts of the abdomen.
Okay, bonus to the public health. After birth, where do you expect to assess fundal height?
Madam, beneath the abdomen, the umbilical region.
Okay, correct. That is at the umbilicus or near the umbilicus. Okay, we have come to the end of obstetric. We are now moving on to reproductive health. So we started from public health. We are now going to start from midwifery and move like this. Okay, so public health, question number 1. Sorry, midwifery, question number 1, thank you. Ectopic pregnancy, higher risk for cervical cancer and pelvic inflammatory disease. Which of these is a health problem that can be caused by STIs in women? Ectopic pregnancy, higher risk for cervical cancer, and pelvic inflammatory disease, PID. Which of these is a health problem that can be caused by STIs in women?
Higher risk for cervical cancer can be caused by...
Now listen to the question. Ectopic pregnancy, higher risk for cervical cancer, and pelvic inflammatory disease. Which of these health problems can be caused by STIs in women? Which of them?
cervical cancer.
Wrong. Bonus goes to the nursing department. Ectopic pregnancy, higher risk of cervical cancer, and pelvic inflammatory disease. Which of these is a health problem that can be caused by STIs in women?
Pelvic inflammatory disease.
Correct for 1 mark. Now we now go to the nursing department. Chlamydia is caused by a bacteria called
Streptococci.
Bacteria called what?
Streptococci.
Wrong. Bonus goes to public health. Chlamydia is caused by a bacteria called
Treponema.
bonus goes to midwifery. The correct answer is Chlamydia trachomatis. Okay, now let's go to the public health. Syphilis is caused by a bacteria called
Treponema pendulus.
correct. Correct for 3 marks. Midwifery. The inability of a male to achieve orgasm despite adequate stimulation is termed. The inability of a male to achieve orgasm despite adequate stimulation is termed.
Organosmia.
Go over it again.
Organosmia.
Wrong. Can you spell it?
Anorgasmia.
Correct. Next thing, which contraceptive method is most suitable for a couple with 2 children who wish to delay pregnancy for 5 years? Which contraceptive method is most suitable for a couple with 2 children who wish to delay pregnancy for 5 years?
Using the patches, hormonal.
Wrong.
Intrauterine.
To the public health department. Which contraceptive method is most suitable for a couple with 2 children who wish to delay pregnancy for 5 years?
So it's Jadel implant.
Correct. Okay, public health. The combined oral contraceptive pills works best for a breastfeeding mother since it does not affect her milk supply. True or false? The combined oral contraceptive pills. Correct. Okay, midwifery, your question. Ghana's Comprehensive Abortion Care CAC policy aims to increase penalties for illegal abortions. True or false? Ghana's Comprehensive Abortion Care policy aims to increase penalties for illegal abortions. True or false? False. Nursing. What is the role of condoms in family planning?
Madam, please, to prevent fertilization. The sperm to enter the vagina.
Okay, correct for 2 marks. It prevents pregnancy and it also protects against sexually transmitted infection. Correct for 2 marks. Okay, now let's go to the public health. Breastfeeding can be used as a family planning method. True or false?
True.
Correct. Midwifery. Mention any 2 side effects of hormonal contraceptive. Mention any 2 side effects of hormonal contraceptive.
Spotting and nausea.
Spotting. Correct. Nursing. What is an emergency contraceptive? What is an emergency contraceptive?
An emergency contraceptive will prevent pregnancy after 72 hours of sex. 72 hours of sex.
Correct. For 3 marks. It prevents pregnancy between 3 to 5 days, that is 72 hours. Okay, public health. Cultural and societal norms have no effect on reproductive health. True or false?
False.
Correct. Midwifery. Comprehensive sex education can help overcome barriers to reproductive health. True or false? Correct. Transmitted infections, STIs, can only be transmitted through sexual intercourse. True or false?
False.
Correct. Public health, lactational amenorrhea method, LAM, is a contraceptive method which is effective for up to 1 year after birth. True or false?
False.
Correct. Sorry. Midwifery, question 5. Emergency contraceptive can be used as a regular family planning method. True or false?
False.
Correct. General nursing, that's all right. Okay, we have come to the end of round 1. Please, let's clap for the contestants. They have done well. No, it's not easy. So we are going to wait for our judges to give us the scores for this round. Then we prepare for round 2.
Baby, Well done. Please calm down and let's listen to the scores from our judges. Thank you.
Okay.
Okay, hello. For the first round, we had 3 sections: anatomy, obstetric nursing, and reproductive health. For the anatomy, nursing had 16 marks. For obstetric nursing, we had 0. And for reproductive health, nursing had 9. So in total, they had a mark of 25.
Hello? Are you feeling it? Can I hear a bigger yeah? So I'm speaking on behalf of the PHNs. They started funnily, but they got there. So at the first round, they came out with 6.5. For obstetrics, they came out with 10 marks. And lastly, with the reproductive section, they came out with 17 marks. At the end of the day, we came out with 33.5 marks. Well done.
Okay. I will be speaking on behalf of the midwifery. For anatomy, they were able to come up with 5 marks. Reproductive, they were able to come up with 9 marks. And then for obstetric, they came up with 14 marks, a total of.
Let's settle down. We still have 4 more rounds to go, so you just have to calm down. Let's continue. Now let's start for round 2. We are starting the medical and surgical nursing. So we are going to start with the nursing department. Question number 1, nursing. What is the normal range of blood pressure? What is the normal range for blood pressure?
So systolic 120 to 121 and 129, and diastolic 80 to 90.
Correct for 3 minutes. Midwifery. Which electrolyte imbalance is commonly associated with arrhythmias? Which electrolyte imbalance is commonly associated with arrhythmias? Okay, bonus to public health. Which electrolyte imbalance is commonly associated with arrhythmias?
Sodium and calcium.
Wrong. Bonus to general nursing. Which electrolyte imbalance is commonly associated with arrhythmias?
Hyperkalemia.
What is the name of the electrolyte?
Potassium.
Correct. Yes, What is the hallmark symptom of myocardial infarction? What is the hallmark symptom of myocardial infarction?
Madam, heart attack.
Wrong.
Cardiac congestion.
Wrong.
Angina. Angina pectoris.
I should give them, yes. I should give them 2. Okay, correct for 2 marks. Okay, general nursing. Please, can we stop noise? What is the primary indication for an appendectomy? What is the primary indication for an appendectomy?
Inflammation of the appendix. Inflammation of the appendix.
Correct for 3 marks. Okay, midwifery. What is the name of the procedure for gallbladder removal? What is the name of the procedure for gallbladder removal?
Madam, cholecystectomy. Cholecystectomy.
Wrong. The pronunciation is wrong. Bonus for public health nursing. What is the name of the procedure for gallbladder removal?
Okay, so it's cholecystectomy. Cholecystectomy.
Bonus for general nursing department.
Colostomy.
Come again.
Colostomy.
No, you are wrong. It's cholecystectomy. It's spelled CHOLECYSTECTOMY. Now, which department was that for? It was for midwifery. Okay, now let's go to public health. What vessels are commonly used for coronary artery bypass graft? CABG. What vessels are commonly used for coronary artery bypass graft?
The artery.
What vessels are commonly used for the coronary artery bypass graft? Bonus to general nursing. What vessels are commonly used for coronary artery bypass grafts?
The aorta.
Wrong. Bonus to midwifery. What vessels are commonly used for coronary artery bypass grafts? Now the correct answer is saphenous vein or internal mammary artery. Now those are the arteries. Okay, now let's go to nursing. Name one major factor for hypertension. Name one major factor for hypertension. Yes, medicine.
High sodium levels.
Wrong. What is that?
Atherosclerosis.
Wrong.
High sodium intake.
Okay, so this particular one, I have to come in and say one or two things, because if you look at the answers we have, maybe the best is to overrule it and then we'll move on. Why am I saying that? Our answer here is specifically on what? Obesity. Okay? And in talking about risk factors, it's very difficult for you to just hit hard on only obesity, because immediately you talk about obesity, they have given you atherosclerosis and whatnot, which can what? Come up as a result of what? This same obesity thing. So it's very difficult for you to limit the discussion to just only obesity as a what? A major risk factor. There are several major risk factors and I can submit to you for now. So let's have that out. No, we shouldn't.
Okay. Which part of the heart is typically affected in left-sided heart failure? Which side of the heart is typically affected in left-sided heart failure?
So we have the left border of the heart and the apex.
Correct for 3 minutes. Okay, midwifery. FAST is an acronym used for stroke detection. What does it stand for? FAST, F-A-S-T, is an acronym used for stroke detection. What does it stand for? FAST. Okay, bonus goes to public health. FAST, F-A-S-T, is an acronym used for stroke detection. What does it stand for?
Pass.
Okay, moves to general nursing. FAST is an acronym used for stroke detection. What does it stand for? Okay, so it's an acronym used for face, arms, speech, and time. was midwifery. Public health, your question. What is the major cause of ischemic stroke? What is the major cause of ischemic stroke?
A plaque is formed in the blood vessels, which causes the blockage.
Correct. For three marks. Okay. So we now go to, let's now go to surgical. Nursing. What is laparotomy? What is laparotomy?
Removal of the upper part of the esophagus.
Wrong. Okay, bonus goes to midwifery. What is laparotomy?
It's a large incision in the abdominal cavity.
Correct. Midwifery, your question. What is the most common complication following an appendectomy? What is the most common complication following an appendectomy?
Pain.
Wrong.
Pain and infection.
Correct for 2 marks. Correct for 3 marks. Surgical site infection. Public health nursing. Which diagnostic tool is often used before cholecystectomy, rather? Which diagnostic tool is often used before cholecystectomy?
Okay, so CT scan.
Wrong.
MRI.
Wrong. Nursing.
Madam, please, we have burial.
What diagnostic tool is often used before cholecystectomy?
Endoscopy.
Wrong. Bonus to midwifery. What diagnostic tool is used before cholecystectomy?
Ultrasound.
Correct. Who? Public health. Okay, now go back to nursing. What does COPD stand for? What does COPD stands for?
Chronic obstructive pulmonary disease.
Correct. Midwifery. What is the primary cause of tuberculosis?
You should stop now.
Viral infection.
The name of the viral infection. Okay, bonus to the public health department.
Inhalation of the tuberculous bacteria.
Wrong. Bonus to nursing department.
Microbacterium tuberculosis.
Correct. Okay, we now go to public health nursing. What vaccine is used to prevent pneumonia in adults? What vaccine is used to prevent pneumonia in adults?
So the pneumococcal vaccine.
Correct. Okay, back to. Okay, now we are now going to go to pharmacology. We are going to start with the midwifery department. This one, there's no pharmacist here. I told Dr. Norma to come. Let me know. Midwifery. What is the primary use of antibiotics in medical surgical care? What is the primary use of antibiotics in medical surgical care?
Antibiotics are given to treat bacterial infections in the body.
Correct. Public health. Name 2 classes of antibiotics commonly used in treating bacterial infection. Name 2 classes of antibiotics commonly used in treating bacterial infections.
Madam, the bactericidal and the bacteriostatic.
Wrong.
The antibiotics and antifungal.
Wrong. Bonus to nursing.
Madam, please, we have ciprofloxacin and amoxicillin.
Please go over it again. Spell the first one.
CIPROFLOXACIN.
And what?
Amoxicillin.
Spell it.
AMOXIC.
Wrong. Midwifery bonus.
We have amoxicillin. Amoxicillin.
Wrong. It's penicillins and cephalosporins. Those are the drugs. Nursing department, your question. What are 2 important considerations when administering antibiotics? What are 2 important considerations when administering antibiotics.
Please, so we have the route for the administration, and we also the right dose as well.
Correct for 2 months. Important is for, you first of all check for allergies, then you adjust the doses. So correct for 2 months. Okay. Midwifery, your question. Which type of analgesic is associated with the risk of respiratory depression? Which type of analgesic is associated with risks of respiratory depression? Doctor, no money. Okay, bonus to public health. Which type of analgesic is associated with the risk of respiratory depression?
Codeine.
Codeine. Wrong. Nursing.
Opioids.
Correct. You said opioid. Correct. It's an opioid known as morphine. Okay. So the next group is, who just asked, whose question was that? Midwifery. Now we go to public health. Name one analgesic that does not have anti-inflammatory properties. Name one analgesic that does not have anti-inflammatory properties.
Aspirin.
Wrong.
Paracetamol.
Wrong. Okay, correct. For paracetamol. Okay, we now go to nursing. What are two possible side effects of NSAIDs? What are two side effects of NSAIDs?
Madam, please, we have GERD and nausea.
Come again.
GERD, G-E-R-D, and nausea.
And nausea.
Yes, please.
Correct. Now, that particular question comes with a case scenario, which I'm going to give it to you. A patient is given ibuprofen post-surgery for pain. After a few hours, they complain of stomach pain and nausea. What could be causing these symptoms? A patient is given ibuprofen post-surgery for pain. After a few hours, they complain of stomach pain and nausea. What could be causing these symptoms?
Okay, so the cause of the stomach pain could be as a result of high gastric secretions.
It's correct. Clap for them. It Now that question was a case scenario question that came with their answer. So since they got the answer, they had to answer a case scenario and they got it. So you give them their full marks. 3 points, please. Midwifery. What is the main purpose of anticoagulants?
To prevent blood clots.
Clap for them, correct. Public health. Which blood test is commonly used to monitor patients on warfarin therapy? Which blood test is commonly used to monitor patients on warfarin therapy?
Hemoglobin level test.
What is the blood test called?
Hemoglobin level test.
Wrong.
Full blood count or the tidal.
Nursing. What blood test is commonly used to monitor patients on warfarin therapy? What is the blood test?
We have blood stool test. Blood stool test.
Wrong.
We have hematocrit levels.
Wrong. Bonus to midwifery. Okay, the correct answer is INR test. It's called International Normalized Ratio. Okay, the next question goes to nursing department. Name one anticoagulant that can be administered subcutaneously. Name one anticoagulant that can be administered subcutaneously.
Madam, please, we have warfarin. Warfarin.
Spell?
WARF.
Wrong. Bonus goes to midwifery. Your time was already up and you're wrong. Name one anticoagulant that can be administered subcutaneously. Okay, public health.
Madam, the warfarin.
Spell?
WAFRIN.
Wrong. The correct answer is enoxaparin. That is the correct answer. Love it, ducks. Okay.
Okay, so looking at the various medications, we find out that we have the generic names and we have the trade names. So from the manufacturer, when it comes with a generic name. So for instance, we have maybe Meronim. Meronim has other types of Meronim, but we have the generic and its trade name. So for that answer, looking at the medication here, is the generic name.
That was
warfarin,
given.
yes. So warfarin is a brand name, and definitely it should have been given to them. It should have been given to them. So it's correct.
Okay. Midwifery. What is the main function of anti-diabetic medication? What is the main function of anti-diabetic medication?
To control blood glucose level.
Correct, clap for them, please. Public health. What type of insulin has the fastest onset of action? What type of insulin has the fastest onset of action? What is the name of the insulin? Okay, bonus question goes to nursing. What type of insulin has the fastest onset of action?
So we have the intravenous type.
The name. Midwifery, the name. What type of insulin has the fastest onset of action? Okay. The correct answer is rapid acting insulin. Insulin like Lispro. That's the name. Rapid acting insulin like insulin Lispro. That's the correct answer. Okay, now the next question goes to nursing department. Name two considerations when administering an oral anti-diabetic medication. Name two considerations when administering oral anti-diabetic medication.
So we have, first of all, bioavailability, and we have stomach motility. We have bioavailability and stomach motility.
Wrong. Midwifery bonus question. Name two considerations when administering oral anti-diabetic medication.
You check for the time, you consider the time and then the right dose.
Wrong. Public health.
Patient. The glucose level of the patient.
Have. Correct. You have to monitor the blood glucose level before administering and check for signs of hypoglycemia. So, have. Yes, have. Yes. So the next question goes to midwifery. What is the primary purpose of anti-hypertensive medication? What is the primary purpose of anti-hypertensive medications?
To reduce high blood pressure.
Correct. Public health. Name two common classes of anti-hypertensive drugs. Name two common classes of anti-hypertensive drugs.
Calcium channel blockers and then diuretics.
Correct. Nursing. What should be monitored regularly when a patient is anti-hypertensive? What should be monitored regularly when a patient is on an hypertensive?
The blood pressure.
Correct. We are done. of the second round. So let's wait for the results for the second round. Please, let's clap for them. They did very well. I'm impressed.
Hello. 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 Are we tired? You are hungry. God will provide. Amen. Oh. Nurses, are we not happy? You are what? You are hungry. You want malt. More action, less talk. That's smart. Okay, we are waiting for our judges to give us the scores for round 2, and then we proceed. Mr. DJ. Just release some stress, okay? There's too much tension in the room. Midwives, hello. Is everything okay? Midwives. Okay. Are we good? Are you good? No, you came in with much pressure. But it's like the heat has been quenched. The heat has been quenched. Yes. Adelaide, looking at the pressure they came here with. And see how they are. Oh, sorry. PHN. Judges. Okay. Please, they are ready, so let's listen to the judges.
Round 2. Under medical nursing, we had 11 points. Surgical, 3 points. Pharmacology, 12. In total, nursing had 26.
Okay, for midwifery round 2, medical and then surgical nursing, they had a combined point of 5 marks, and pharmacology, they have 12 marks, a total of 17 marks.
Okay, so for PHNs, the first round, both the surgical and the medical, we have total mark of 8 marks. And for the pharmacology, we had 9.5. That's about 17.5 marks. Thank you.
Okay, now let's now proceed to round 3. Let's be a little bit fast so that let's stop noise so that we can go a little bit faster. Okay, for round 3, we are starting the medical legal issues in nursing. It's a riddle-based question. Medical legal issues in nursing, and is a riddle-based question. So the last one, where did we start from? Was it nursing? Was it midwifery we started with? Public health. So we are going to start with nursing now. I started with them. Okay. Okay, we are now starting the medical legal issues in nursing. It's a riddle-based quiz. So we are going to be starting with the nursing department. Please, let's listen while we try to solve the riddle. I guide you to do good, to act in the patient's best interest. Without me, care becomes cold and clinical. What am I? I guide you to do good, to act in the patient's best interest. Without me, care becomes cold and clinical. What am I?
Vital signs.
Wrong.
Autonomy. Autonomy.
Wrong. Midwifery bonus. I guide you to do good, to act in the patient's best interest. Without me, care becomes cold and clinical. What am I?
Nursing process.
Wrong. Public health.
Beneficence.
Correct. Midwifery. I stand for do not harm, ensuring your actions don't cause injury or pain. What am I? I stand for do not harm, ensuring your actions don't cause injury or pain. Who am I?
Non-maleficent.
Correct. Please, let's clap for them, clap for them. Public health. I grant the patient the power to decide. Respect my wishes and you'll abide. What am I? I grant the patient...
Autonomy.
Correct. Clap for them. Nursing, before you touch or treat, you must ask and explain. Without me, your actions might be in vain. What am I? Before you touch or treat, you must ask and explain. Without me, your actions might be in vain. What am I?
Informed consent.
Correct. Midwifery. I balance the scales, ensuring fairness for all. Without me, no one is big and no one is small. What am I? I balance the scales, ensuring fairness for all. Without me, no one is big and no one is small. What am I?
Justice.
Correct. Public health. If intentional harm leads to a patient's end, it's more than negligence. It's my name you must defend. What am I? If intentional harm leads to a patient's end, it's more than negligence. It's my name you must defend. What am I?
Thought.
Wrong.
It's not. My name might
Madam, battery.
Battery. Wrong.
Malpractice.
Wrong. Bonus goes to nursing. If intentional harm leads to a patient's end, it's more than negligence. It's my name you must defend. What am I?
Intentional thoughts.
Wrong.
Negligence of duty.
Wrong. Bonus to midwifery.
Negligence.
Wrong. that it? The correct answer is murder. Nursing. When I am ignored, ethical dilemmas arise. My principles guide nurses to act wise. What am I?
Code of ethics.
Correct. I'm the midwifery. I'm the document that shows the patient understands. Without me, care could lead to reprimands. What am I?
Consent form.
Correct. Public health. When harm is unintended, yet preventable, I am named. Address me to ensure safety is claimed. What am I? When harm is unintended, yet preventable, I am named. Address me to ensure safety is claimed. What am I?
Negligence.
Correct. Nursing. I am the patient's voice when they cannot speak, ensuring their wishes are heard in what I seek. What am I? I am the patient's voice when they cannot speak, ensuring their wishes are heard is what I seek. What am I?
Advocacy.
Correct. Midwifery. I am the written or verbal permission required before care proceeds. Forget me and you risk legal misdeeds. What am I? I am the written or verbal permission required before care proceeds. Forget me and you risk legal misdeeds. What am I?
Consent.
Wrong.
Consent form.
Wrong. Public health. Nursing.
Rights of the patient.
The correct answer is informed consent. She said consent. It is an informed. We have different types of consent, but this particular consent is an informed consent.
Hello. So the consent form is the document. Okay? Whether it was said, whether it was discussed, something will be filled to show that something like that has taken place. Informed consent is the information you are giving to the patient to prepare the patient for whether a procedure or anything that will be coming on. So one is a document, one is an information. So when you say consent and you are not specific, you'll be wrong. That's why we want you to say the actual thing that fits in the brackets. Please, you understand. Thank you very much.
I happen when you disclose what should stay concealed. Breach me and trust might never be healed. What am I? I happen when you disclose what should stay concealed. Breach me and trust might never be healed. What am I?
Confidentiality.
Correct. Nursing. I am the law that protects patients' information. Know me well to avoid a legal confrontation. What am I? I am the law that protects patients' information. Know me well to avoid a legal confrontation. What am I?
Thoughts.
Wrong.
The right of patient.
Wrong.
Patient document.
Midwifery bonus. I am the law that protects patients' information. Know me well to avoid a legal confrontation. What am I? Public health.
Code of ethics.
Wrong. Health Insurance Portability and Accountability Act. Okay. Midwifery, your question. I protect you from harm. I protect you from harm.
The question is saying that I'm a law that protects patient information. So definitely this should tell you it's an act. It's a policy. And those policies, if you don't know, you have to go and learn them. Do you get it? We have so many acts. Okay? Good.
Midwifery, I protect you from harm while holding you accountable. Nurses know me as a shield that's valuable. What am I? I protect you from harm while holding you accountable. Nurses know me as a shield that's valuable. What am I?
Accountability.
Wrong. Bonus goes to public health. I protect you from harm while holding you accountable. Nurses know me as a shield that's valuable. What am I?
Code of ethics.
Wrong. Bonus goes to nursing.
Code of conduct.
Wrong. The correct answer is professional indemnity insurance. Now the last question goes to public health. I occur when you restrain a patient against their will. Name me correctly to avoid legal trail. I occur when you restrain a patient against their will. Name me correctly to avoid legal trail. What am I?
Malpractice.
Wrong. Bonus to nursing.
We have false imprisonment.
Correct. Okay, we have come to the end of round 3. So let's wait for the judges.
Hello. third round. Nursing. Can you hear me? Hello? Hello? At the end of the nursing had a mark of 10. 10.
Let's clap for them.
So with the third round, the PHNs are 10 marks as well. 10.
At the end of the third round for midwifery, they had 9 marks.
Okay, now we are going to round 4, which is current affairs.
Oh baby girl, you know you got the juice, you got the fire. Cause one man's meat is another man's poison. To all the people who do me wrong, oh they let me straight to you. May I sit? I wonder if you think say I believe you. See, I go fight for your love. I go go off for your love. I go give up on my girls for your love. Yes, Lord. What are we doing to your sin? Oh, baby girl. Believe me, friend, me and fire us. Me and
Amen. Are we living nurses?
if you wind up, my body coming over. I wanna be queen of Jamaica, queen of dance hall. Spice. We are gonna mash up the world.
I'm seeing a new face there. Midwifery.
You ready?
All right. Please, they've called for a reinforcement. They are called rep. Let's see if she can do some magic. Please, keep quiet and let's move on.
Yo. Yeah, let my chicken see the body, them a wine. Yeah, let my chicken see the body, them a wine. Yeah, let my chicken see the body, them a wine. Yeah, let my chicken see the body, them a wine.
Round 5 is the practical quiz question. So if you want to change anybody in your group, you feel you want to change somebody, you can just do it now. Okay. Okay, now let's start. Are you okay?
Hello, madam. Please come again.
If you want to change
which
any
round is this?
practical quiz questions.
Round 4.
Yes, round 4. So I don't know if you want to change anybody in your group. No. You want to change anybody? Okay, the last time we started with nursing, so now we are going to start with midwifery. Question number 1. The nurse is taking the vital signs of the patient admitted with cancer of the pancreas. The nurse is aware that the 5th vital sign is. The nurse is taking the vital signs of the client admitted with cancer of the pancreas. The nurse is aware that the 5th vital sign is what? Bonus goes to public health. The nurse is taking the vital signs of the patient admitted with cancer of the pancreas. The nurse is aware that the fifth vital sign is
There's PO2.
wrong. Nursing,
Random blood sugar.
wrong. The correct answer is pain. Public health, your question. Please let's listen and listen very carefully. This is a practical question, so you need to be very attentive, please. A client is admitted to the hospital following a gunshot wound to the abdomen. A temporary colostomy is performed, and the physician writes an order to irrigate the proximal end of the colostomy. The nurse is aware that the proximal end of a double-barrel colostomy is the end that... I'll go over the question again. Please listen and listen good. A client is admitted to the hospital following a gunshot wound to the abdomen. A temporary colostomy is performed, and the physician writes an order to irrigate the proximal end of the colostomy. The nurse is aware that the proximal end of a double-barrel colostomy is the end that...
That is sutured.
Wrong. Bonus to nursing.
It is the end that it's close to the liver.
Correct. The opening to where the liver is at the right side. Okay, the next question goes to, that was your question, right? The next group goes to nursing. That is for bonus. I should go through the question again.
Okay, so I just wanted to comment small on that. In fact, to be very realistic with you, we are very lenient by just giving you that. Yes. Because the general undertaking on this question is that we just want to know where the bag would be hung. And when the bag is hanging on the right side, what does that mean? When it's hanging on the left side, what does that mean? That's just all. Okay, so basically you have given us, let's say, around the liver, and we are just tempted to be what? Half. Let's give you half, so that we know that at least you did your best.
Okay, the nursing department. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per ml. How many milliliters should the nurse administer? Round to 1 decimal point. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per ml. How many milliliters should the nurse administer and round to 1 decimal point?
.6. Sorry, 0.2 liters.
Okay, the bonus goes to nursing. Oh, midwifery rather. Public health. A nurse is to administer 10 milligram of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 50 milligram per ml. How many milliliters should the nurse administer? Round to 1 decimal point. So the correct answer is 0.7 ml. Okay. Now the next. It was 0.7. It says 0.6. If a 0.1 will kill someone. Okay, midwifery, your question. A client's chest tube is to be removed by the physician. Which type of dressing should the nurse have ready to be placed directly over the wound when the chest tube is removed? A client's chest tube is to be removed by the physician. Which type of dressing should the nurse have ready to be placed directly over the wound when the chest tube is removed? Public health.
Aseptic dressing.
Wrong.
Madam, please, we have pressure dressing.
Wrong. Okay. Wrong. Your time is up. The correct answer is petroleum gauze dressing. Okay, public health, your question. Inflammation is a normal immune response, and all student nurses must be knowledgeable about it. The cardinal signs of inflammation include
Madam, reddening of the area, swelling.
At least you should give me 4 to get your correct score. You've mentioned 2, remaining 2.
Stasis of blood over there.
Start from the beginning again.
Reddening, swelling, stasis of blood at the area.
No.
Clothing. Pain.
Okay, correct for 2 marks.
Pain.
Heat. Pain, correct for 2 marks. You've answered 3. I wanted 4. Heat, redness, pain, swelling, loss of function. Correct for 2 marks. Okay, next thing. A proper patient positioning is integral to client care / surgery outcomes. Which patient position is commonly used for surgeries involving the head and neck? Proper patient positioning is integral to client care / surgery outcomes. Which patient position is commonly used for surgeries involving the head and neck?
We have the Fowler's position.
Wrong.
Trendelenburg position.
Wrong. Okay, bonus goes to midwifery.
Semi-Fowler's position.
Wrong.
upright position.
Wrong. Correct answer is prone position. We have supine and we have prone position. Okay. Next question to midwifery. Proper patient positioning is integral to client care / surgery outcomes. Which patient position is commonly used for surgeries involving the anal or vulvar regions?
Lithotomy position. Lithotomy position.
Lithotomy, correct. Public health. Which patient position is commonly used for surgeries involving the chest or thoracic region? Which patient position is commonly used for surgeries involving the chest or thoracic region?
Supine.
Correct. Clap for them. Now let's go to nursing. Which patient position is commonly used for surgeries involving the pelvis or lower abdomen?
Limbic position.
Correct. Clap for them. Now we are now going to true or false statements. Midwifery. Pressure ulcers are usually located over bony prominences and caused by unrelieved pressure, resulting in damage of underlying tissue. True or false?
True.
Correct. Public health. Dirty, infected, or septic wounds. These are surgical wounds in which the respiratory, alimentary, genital, or urinary tract has been entered. I'll go over it again. Dirty, infected, or septic wounds. These are surgical wounds in which the respiratory, alimentary, genital, or urinary tract has been entered. True or false?
False.
Correct. Nursing. In the wound healing process, wounds are sometimes left open for 3 to 5 days to allow edema, infection, or exudate to drain. This type of wound healing can be referred to as secondary healing. True or false?
False.
Correct. Midwifery. The student nurse knows that the physician has documented a diagnosis of herpes zoster, that is shingles, in the male client's chart. Based on your understanding of the cause of this disorder, the nurse determines that this definitive diagnosis is mostly made culture of the lesion test. True or false? I'll go over the question again. The student nurse notes that the physician has documented a diagnosis of herpes zoster, which is shingles, in the male's client chart. Based on your understanding of the cause of this disorder, the nurse determines that this definitive diagnosis is mostly made culture of the lesion test. True or false?
False.
True. Public health. When assessing a lesion diagnosed as malignant melanoma, the student nurse most likely expects to note an
Hello. Hello. Hello.
So let's wait for the result while we prepare for the last and final round. So we prepare to announce our winner.
At the end of the fourth round, Nelson had 9.5 marks.
And at the end of the fourth round, the PHNs had 11 marks.
Okay, at the end of the fourth round, Midwifery had 6 points.
Of this competition. And the current affairs is a fire question. I'll just keep on reading. And you're attempting once, right? You're attempting once. So you're going to start with the public health. What is the current percentage of health expenditure in Ghana's national budget 2024? Is it 1 minute, right? 30 seconds. I should go to the next person. 65%. Okay.
65%.
Wrong.
45%.
Wrong. Next in your question. No, there's no bonus for this round. Which hospital was recently inaugurated as Ghana's largest specialist hospital? One minute.
Kolebu Teaching Hospital.
Okay, wrong. Midwifery, what major health campaign was launched in 2004 to address maternal mortality in Ghana? Public health, which communicable disease saw an outbreak in Ghana in 2024, leading to an emergency response? Correct. Next thing, what is the maximum nurse to patient ratio recommended by Ghana's Ministry of Health?
One is to 3.
Wrong. The answer is 1 to 20. Midwifery, which region in Ghana recorded the highest number of malaria cases in 2023? Public health. What national program focuses on universal health insurance coverage in Ghana?
Health insurance.
Correct. Next, name the current Minister of Health in Ghana.
Dr. Bernardo Kuboy.
Correct. Midwifery, what is the largest year for Ghana to achieve universal health coverage? What is the target year for Ghana to achieve universal health coverage? Health, who is the current Speaker of Ghana's Parliament?
Right Honorable Alban Sumana Babin.
Correct. Next thing, what significant governance policy was launched to curb corruption in Ghana? Midwifery, how many regions does Ghana currently have? Correct. Public health, what is the primary function of the Electoral Commission of Ghana?
So, to oversee all electoral activities that goes on in the country.
Correct. Next thing, when was the Right to Information Act passed in Ghana? When was the Right to Information Act passed in Ghana? When? Midwifery, who is the current Chief Justice of Ghana? Public health, what key project focuses on digitization of government services in Ghana?
Ghana card.
Wrong. Next thing, which Ghanaian president initiated the free senior high school policy? Correct. Midwifery, what is the term length for the president of Ghana? What is the term length, the length for being president of Ghana? Correct. Public health, who was Ghana's first female chief of staff?
Madam Joyce Bamfo Ado.
Wrong. Next thing, which body is responsible for reviewing the 1992 Constitution? Which body is responsible for reviewing the 1992 Constitution?
Parliament.
Wrong. Midwifery, how many parliamentary seats are currently in Ghana's parliament?
275.
Correct. Public health, which political party is the oldest in Ghana? Which political party is the oldest in Ghana? Next thing, what system of governance does Ghana practice?
Democracy.
Wrong. What is the minimum age to contest for the president in Ghana? I finished. I don't even know. So we've come to the end of this competition. Please let's clap for our contestants. They did very well. While we wait for our judges to collect the results and we give out the prizes, please clap for them, clap for them.
But we are nurses and midwives, so why character first now? We are nurses. Hey, no, they don't teach us. So why?
You should know.
Madam said you should know. It's part. You should know. Okay? So, who is winning? Mr. DJ. Mr. DJ. DJ. Okay, so while we await the final scores, Mr. DJ, can you please give us some music while we await the final scores? Yes, just to release their stress. In fact, all the contestants have done well. Let's give it up to them one more time. They've done well. Yeah, they won't bet now. Clap for them. They have done well. Oh. Yes. 2 + 2 cry, you don't know. Someone has been here, answered questions. You are here laughing. Clap for them. They've done well, please. We beg. Eh? Oh, Mr. DJ. Okay, so the judges are collating the results. Please come again. Oh, DJ name. Nelson, yes, Mario. Oh, Nelson. Okay. Nelson, Mariana. Oh, is it possible? On this one, they say we should leave it to God. Yes, we are nurses. We don't do current affairs. So this one is a cheat. Yes, it's a cheat. But you should take the history lesson serious. So you see, if I should ask you the president of Ghana is, you don't even know. Eh? Near beside the age. I heard one question. What is the age? Age something. It's 40 years now. Oh, DJ, please, are you sleeping? Oh. So we wait for the final results and then, please, yes, we wait for the results and then the prize distribution to the contestants. Okay, so let's not be tired. The game is not over yet. It's not over until it's, I know you are all hungry, but please wait and listen to the final scores. Okay? Or you say you know who is winning already. You see, you underrated them all. When you were beginning, no. But they're also in level 300. It doesn't matter. Please, the judges are ready, so let's listen to them. Please, please.
Hello.
Maintain silence.
Good afternoon. We really had a nice time, isn't it? Yeah. Oh, if you really had a nice time, can I hear yeah. You know, nursing is difficult. Yes. When you are in the nursing school, there are so many things you are expected to know. Though they think we are King Kong, but Charlie, it's not easy. But you guys have done very well, especially when you are asked to sit here and you don't even know what you are up to. The questions come, it's not that they don't know, but in this bit is a hot seat, so it's quite difficult. But I want to draw our attention to something. I realized that most of the questions that were asked here, most of them came out in licensure. 2 years ago, 3 years ago, some of the questions here came. And I'm sure most of the questions were picked from that particular area. Let's not do it as if we are joking. Let's be learning alongside simple things that will lead us to the answer, we overlook them. Otomy, ectomy, you hear something like laparotomy and you're saying removal. Nursing, that was not good enough. You hear ectopic, your mind should go somewhere. You see, you should have clues of this word so that when you are using them or you are applying them, it will be very easy for you. I'm not expecting you to do otomy and say removal. You know, you are looking into something. If it's ectomy, you are saying you are removing something. So play with the words. Don't just sit in the nursing school because like look as if you have never been to nursing school before. And don't fall a victim of failing licensure because it is very, very depressive. So I want to applaud every one of you. Your teachers, your lecturers are doing very well. Kudos to all those who participated and kudos to you for applauding them. Clap for yourself and clap for them. All right, so we are going to announce the winners. We are not going to fight over it. This is one of the fun fairs we normally have as nurses. We joke about it. When we finish, we dance, we drink, then we go home. Do we have a deal? Congratulations, everybody. Thank you so much.
Hello? Yes. Please, like she rightly said, take Mrs. Quatin's advice. It's very, very important. There are some key things she mentioned there. As in, those questions, I don't know wherever they set it from. But let's take it very serious. Like she said, they are likely licensure questions. So I hope we all paid attention to them. Okay, so in this order, in this particular order, this is the result for the day. So in the third position, the result was 69, and the department was midwifery. In the second position, the result there was 76.5, and it was accumulated by the nursing students. Now, the overall winner for today's program is the Public Health Department. Let's give them a round of applause. Are you smart or are you ready for the action? Many rapid here transaction. Go to my share, go and check the reaction. Or you going global, the X-Ferry mobile. Head up, make a big move for 1 year. Yeah, I never wanna mind us, but see how we go now. This is how it goes now. Oh, got super close now. Girls wanna take some photos, give them some news now. Close now.
Congratulations to the public health nurses. Congratulations to the public health nurses.
For the host, they do with their nose, and I link with the nose. Looking back with smart say only God and king.
Hello. Sorry. It seems they didn't hear their marks. They had 84 points.
Yes, they had 84 points. Yes, general nursing 76.5. Midwifery 69. Please celebrate them one more time. You are well done. Congratulations to the public health nurses. Yes, once the contest was ongoing, we had the on-site general secretary joining us. Hello. While the contest was ongoing, we had the on-site general secretary joining us. This is the person of Honorable Isifu. Okay, so we'll wait for the presentation of gifts. Let's wait for the presentation of
The prizes for the various departments. Please, there's too much noise.
More music on trendybeats.com. trendybeats.com.
Hello, please, we would like to call on the on-site president, Her Excellency Bolale Williams, to present and then the second runner. Please, she's presenting certificates to the first and second runner-up. So we would like to call on the I'm calling on the Her Excellency Bolale Williams as he presents certificates to the second runner-up. Yes, all the team. Shall we have the midwifery students here? Oh, give it up, let's celebrate them. Give it up for them. They have tried. They came, they tried, and they have conquered. Oh, wow. This is beautiful. This is beautiful. It is very secure. Please, I would like to call on Mr. Callis to present certificates to the first runner-up. Yes. Oh, are you sad? We have tried. We have tried. Congratulations to you all. Congratulations. Police of the local Wow. To present the certificates, the winners. Oh, so shall we have the public health nurses? Oh, you have won. Me, I'm happy for you, okay? Yes. Okay. Please, once again call on the second runner-ups. Those who took the third position. Our midwives. Oh.
When a bitch can't get a dollar out of me, no Cadillac, no purpose, you can't see. Then I'm a motherfucking P, I should agree. Now shorty, she in the club, she dancing for dollars. She got a thing for that Gucci, that Fendi, that Prada, that BCP, she Burberry, Dolce and Gabbana. She feed the food fantasies, they pay because they want. I spit a little G, man, in my gang got her. I hour later had her ass up in the Ramada. Them trick niggas in the ear saying they think about her. I got the bitch by the bar trying to get a drink about it. She like my style, she like my smell, she like the way I talk. She from the country, then she like me cause I'm from New York. I ain't that nigga tryna holler cause I want some head. I'm that nigga tryna holler cause I want some bread. I could care less how she perform when she in the bed. Bitches that try to catch a date and come and pay the kid. Look baby, this is simple, you can't see. You fucking with me, you fucking with a B.I.M.B. I don't know what you heard about me. When a bitch can't get a dollar out of me, you gotta like no purpose, you can't see. That I'm a motherfucking B.I.M.B.
I don't know what you heard about me, but a bitch can't get a blood about me. I drive a Cadillac where a burn cause I'm a G, and I'm a motherfucker see about me. I don't know what you heard about me, but a bitch can't get a blood about me.
Taking the second position, please would like to have you one. Yeah. Yes. Oh, clap, 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 clap. Colleagues of the noble profession. Are we not proud? Are we not proud? Are you not proud? I am a proud nursing student. Wait. It's very, very, very trivial. Yes, and now to our winners. Winners, please. You are coming back again. You come, Her Excellency. Winners, let us see you. See our winners. They came, they tried, they suffered, and they have conquered. Congratulations to you. Public health.
trendybeats.com.
It's very, very Excellency Julius, please our money as winners. We need our money.
I just want you to know that I'm sorry. Sorry for what I did. For what I said.
Thank you very much. The money will surely come due to certain challenges we had with faculty later. I want to assure you that later on your cash prize. Thank you.
We are presenting 20 pounds to the winner.
Hello.
Hello. Hello.
Madam, myself and the students, you all. So give us a day and a day. Let's fix it into our schedule so we go. So proud of. For me, from a business background, I'm not surprised. My little knowledge about health is that these are the when it comes to health. In our communities, you see them there. Everywhere you go, they are there. So I'm not surprised they have won. But I'm happy. The only thing is the winners are not too happy they have won. So God bless you. We are so grateful. And so they will come. So on this note, also from the admissions and marketing, right? So we are also cooking something. So that is also going to be in the form of a quiz like this. That one, the first is not going to be faculty or departmental, it's individual. That is going to be, let us know everything you know about KAAF University. So we said, I know my school, right? So how well do you know KAAF University? So with that, anybody who comes as the winner gets a scholarship for a semester. The next gets, so there are other cash prizes. So you start seeing our flyers. When you see, just register and the day will come that you get a full scholarship for a semester. So this is a very good beginning. I will entreat all of you to be part next time or next year when this is being organized. Next year. And then to the nurses, I saw only men. I saw only men. Please, let's champion. Oh, okay, so next time the HOD is not here, but we'll go and fight her. She can't present only gentlemen on the competition like this. We need to be gender balanced. So aside all things, I'm grateful. I'm so happy. This tells me that KAAF is going so far and so high. So please, let's keep it up. The boldness to even come out, to stand before people for you to be questioned is a lot. So nursing, midwifery, you've all done well. But don't forget the lunch date. Walk to Madam's office or my office and give us the dates and we'll go out. Thank you. Okay, so executives are apart. The Kunmsa executives.
Congratulations, Public Health. Congratulations, the political nurses. They are now political nurses. They have tried. Thank you so much, Deputy Registrar Academics. Thank you so much. We will be leaving soon. Before that, we would like to call on our Kunmsa President, His Excellency Kofi Julius, to give us an acknowledgement, an announcement of other future initiatives. Yes. Please let's listen to him.
Hello. Hello. 1 house, please. I would like to acknowledge the presence of Deputy Registrar, the Dean of Students, and our on-site President. Thank you very much for acknowledging our invitation. And I will extend my gratitude to the account officer, the faculty administrator, and the entire panelists. Thank you very much. And to our winners, congratulations. Okay, you've done well. You've done well. Looking at your situation and all that happened, you've really done well. Going forward, hello. I would like to share something brief with you. This quiz competition has
Hello.
all right. So like I was saying, this quiz competition has come to stay, and it started from somewhere. Someone planted this seed for us to enjoy this competition now. And that person of His Excellency Okutu. Thank you very much, because I serve under him as General Secretary, and we planned this together. But time couldn't permit him, so he left off and handed over to me. And after the seed, a tree with a lot of branches. The branches are the faculty and you, the students' body. Okay, we need to sustain this tree which is the quiz competition. So I'm urging all of you, going forward, this will be an annual event as part of our calendar. So you are winners. Next year by this time, you will come and defend trophy. All right? So all I want to tell you is this event will come to stay. The idea about this quiz competition is to do ourselves for an external quiz. So you are all automatically part of the quiz club. Very soon, we will reach out to ONSAG, which is Student Association of Ghana. We will reach out to them soon. Southern aspect, the nursing school that falls within this region. External quiz. So it shouldn't end here. Let's prepare well. When we go out there, we can make proud. Finally, thank the students. Okay, congratulations. You've done very well. You've comported yourself well. Okay, so I'll end my and thank you very much for coming.
Yes. Her Excellency Lady Adomo, your Vice President, please, we need you here to give us your thanks as we are closing. Yes, Face of KAAF 2020.
Hello. Hello. Please, we need a little bit of your attention. Thank you. Our chair lady, our dean of students, invited guests, panel of judges, ladies and gentlemen. Good afternoon to you all. Except Blossom, with foremost, I thank the Almighty God for giving us to arrange this glorified function as His blessing, and it has sent us this far. His blessing has sent this event to be part of this glorious success. It has been such an honor to be part of this wonderful event. On behalf of the organization, I would like to extend my heartfelt gratitude to our esteemed chairperson, that is Mrs. Anani Donko Linda, our Deputy Registrar, Academic Affairs. We appreciate your presence and love. God bless you so much. And to Mrs. Judith Asante, she is the Dean of Students. We thank you so much, Ma, for your efforts. To Mr. Bernard Ayala, our HOD for Public Health, we thank you so much for your presence and also your support. To Mrs. Dinah Akwa M. Owusu for General Nursing, we thank you so much for your immense support. To Dr. Afram, HOD of Midwifery. To Mrs. Carles, our quiz master, we say God for your time and energy, every brief that you lose. Places. To our on-site executive, we have Ane Ayarina Williams here. We thank you so much for your presence. God bless you so much. And to our General Secretary of ONSAC, Honorable Isifu Mohammed, we thank you so much for your presence. With sincere thanks to the head of the department, with love and gratitude that you've shown us. We are very much grateful for making time for us out of your busy schedules. We say God bless you. We also have an invited guest, that is the HOD, the SRC, the co-MC and the main MC. We say God bless you so much for participating and making this thing a grand success. We also thank our panelists. We say thank you so much for your contribution. Mr. Edu Sapon, His Excellency Enoko Kutu, we thank you so much. Our patron, Mr. Seth Salasiza, we say God bless you for every resource you lost and also accepting our proposal and being there for us. Thank you so much. Thank you so much, everybody, for being part of this program. We say God bless you. Take care and have a nice for yourself.
And to our media team, we say thank you for your efforts, okay? We appreciate you also. Okay, officially, the contest is over. The public health nurses have won. The midwives were last. The general nurses were second. Essential constraint, you were last. Midwifery. Yes, Erica Chopon, please give us a closing prayer.
Thank you, our Lord and Master, for how far you've brought us. Thank you for everything that you've done, for bringing us to a successful spread, and giving us public health.
So enjoy the rest of the day. You see me when I see you. Okay. Bye bye.